So welcome to this NMC OSCE tutoring video. My name is Hannah, and if you are used to my channel, you'll know that I'm a UK nurse and a university lecturer in clinical education and an NMC OSCE programme lead in the past. And I do one-to-one private OSCE tutoring to help you and support you with your OSCE preparation. And I share lots of advice on this channel, which is hopefully helpful. And there's been some great results. I had lots of first-time pass results, both with my tutoring clients this week, but also with those that have purely just used my channel and done a lot of self-study. So well done to all of those. So I thought I'd do a video today to do an update on the new updates. So the NMC brought in some changes to the exam, which came into place on the 30th of September. So it's been nearly a month now. So I thought I'd report back a little bit about how nurses are finding and experiencing those changes now they've been up to test. Okay, so a look at the updates and some information on those updates and things that might have changed and how nurses have experienced those at the test centres. So like I said, the changes came in on the 30th of September, originally the 9th, but then moved to the 30th of September for more time for the test centres to prepare. And just a reminder of those main changes that were advertised out on the NMC website. So there was an increase in the MSU and urinalysis station time from 8 minutes to 12 minutes, an increase in fluid balance to 14 minutes from 12 minutes, removal of in-hospital resus for adult and child, and removal of PPE for non-aseptic procedures, removal of clean and dirty hands stipulation in your ANTT, and instead to follow that ANTT kind of best practice guidelines, thinking around those not contaminating your key sites and your key parts. There was the updated PEWS charts for child OSCE students, so following the NHS England news and PEWS charts. And there was a statement around resits, and candidates can expect a different scenario to test the same skill. So some updates on those. So the station times have been increased for MSU and fluid balance. There's been some confusion because some of the documentation on the test centres websites have remained with the old timings, but those timings are being implemented by the test stations. Obviously, adult resus has gone and child resus has gone, unless you are a resit student who had that station before the changes came in. Removal of the PPE, so it was taken out of the IM marking criteria, but remained in the sub-cut marking criteria, but I'm going to come back to that and the plan changes for that too. The PEWS charts have been in and used in circulation, and the resits. So I'm going to come and talk about the resits and what the resit students are experiencing as well. So some further updates as well, you might not be aware of. So nasopharyngeal suction has also been removed from the adult OSCE. It remains in for child, quite a key skill for child with managing of secretions and bronchiolitis and things such as that, but out for adult. And that might not be overly clear on the NMC website. And unlike resus, it has remained in the marking criteria, but the NMC have confirmed via email with me that that station has been removed. And the marking criteria, they say, has remained for those nurses who have had to resit that station. So that is one station that has been removed. And the test centres are also confirming that they are not testing that station at the moment. The PPE, so there was some confusion around the PPE, like it had been removed specifically from the IM injection station. But it remained in the subcutaneous injection station, and a little bit confusing as why that was. But the NMC again have confirmed via email that they plan to update the subcutaneous marking criteria and remove the PPE requirement. And for both those stations, you don't need to wear PPE unless there is kind of a risk of direct bodily fluid contamination. So their words was if the nurse's skin is broken or the patient's skin is broken. And they're following the WHO best practice for injections toolkit. So I've put the link there so you can Google that and have a look at that if you want to have further information on that change. And you may have also noticed in the marking criteria that the specific answers for the bowel and oral assessment, which were always very clearly written out in the marking criteria, have now been removed, and this is obviously to prevent rote learning. So you want to be thinking and drawing on your clinical knowledge to answer those questions in the bowel and oral assessment written stations. Resit scenarios. So been supporting a couple of students with their kind of second resits who have come to me for help with their second resits, and they have reported going back and having the same stations. So there was a lot of discussion on the internet about what this would look like. At the moment, it seems to be very little changes. You're having the same stations. The API scenarios are the same. Professional value scenarios have been the same. Clinical skill stations have been the same. So just an update there. Doesn't mean that won't change, and things are obviously always changing and progressing with the exam anyway. But that's a little bit of an update on those that are having resits. So what's my advice at the moment? My advice is to be checking the NMC website at least weekly and looking for any new announcements, okay, in that OSCE supporting documents and OSCE test of competence section. I would be checking and downloading the marking criteria and supporting documents, monthly, most probably weekly, actually. And just, going through and comparing with the current one and making sure there isn't any major changes that have occurred. Obviously, the marking criteria gets uploaded, but that doesn't always get put out as an announcement. So you don't always know when it's been changed. So looking at it regularly, and if your test is coming up, I'd definitely be looking at that weekly and checking there aren't any additional changes to the marking criteria. So I hope that's been helpful, a little update on the updates. Again, please feel free to contact me if you want some additional support with your OSCE, one-to-one, in person or online. hannah.l.ames@outlook.com, or head over to my social sites, Facebook and my Instagram page, and put a lot of useful stuff on Facebook as well, beyond just advertising out for my services. So try and share some useful resources and things as well. Hope it's been helpful. Please like, subscribe, and share my videos if they are helpful to you and could be of help to anyone else. And again, big congratulations to everyone that's followed this channel and has passed so far. It's a brilliant achievement to pass your OSCE first time. Well done.